Are medical schemes faring during the COVID-19 pandemic? Should members prepare for extra increases? Jeremy Yatt is Principal Officer of Fedhealth and joins us now via Zoom to talk about the impact of COVID-19 on medical aid schemes. Jeremy, thank you for your time. So the question is the impact of COVID-19, I suppose, on your bottom line as medical aid schemes, but also on the contributions that members can expect to make. My understanding is that part of what has happened with more of us taking more precautions around COVID-19, it has lessened demand and therefore claims around other conditions, seasonal flu, etc., etc. Do I have that understanding correct?
Yes, and thank you very much for having me on your program. It's been a mixed bag. So last year when the lockdown was first introduced and hospitals were preparing for an anticipated influx of COVID patients, we saw very few claims of elective procedures. And elective procedures are procedures such as knee replacements or certain endoscopies that can be done now or maybe next year or at some point. They don't have to be done urgently or on an emergency basis. At the same time, we saw a big reduction in the number of trauma type of cases because, and there was speculation it was around alcohol, but it's actually more around movement. People were driving their cars and going out and hurting themselves. So that was a significant, those two factors together were significant savings for schemes. And I think also because of the anxiety around the COVID pandemic, people were being very careful. So we saw relatively few people contracting the disease and being hospitalized for it. As a result, medical schemes last year did fare better than had been expected. The situation in 2021, though, is different. And unfortunately, the third wave in particular has been very punishing. Sadly, there have been a number of people who have been hospitalized for extensive periods of time and passed away. An average hospital cost for a COVID admission is about 160,000 Rand that the scheme spends. Some of our cases are easily in the R1 million for a patient to be treated in ICU. Our maximum cost has been about 4 million Rand. And those cases do put a lot of pressure on the scheme. Whether it was the Delta variant that led to this is uncertain. I think it's probably a combination of Delta being more contagious and people becoming more relaxed about the disease. So, and unfortunately, the delay in the rollout of the vaccine has contributed to this. If we had been able to roll the vaccine out a little bit quicker before the third wave was peaking in Gauteng, we probably could have seen a number of reductions in hospitalization and in
those are very interesting insights.
Costs.
Yeah, those are very interesting insights there, Jeremy, that you are sharing, particularly the figures around hospitalizations and the need for high care and ICU. Thank you for sharing that really interesting information. But what are the implications then for members' contributions to medical schemes? What's the forecast? What is it looking like?
So you know that normally medical aid contributions increase by about 2 or 3% more than CPI. And last year, schemes made an effort to try and contain those costs, and CPI was lower. This year, it's a little bit early to actually say what the implications will be for contribution rate increases at the end of the year, but you can be sure that the increased pressure that we've seen on schemes from COVID cases, as well as a resurgence of the elective procedures that didn't take place so much last year, will put more pressure on medical schemes. You know that medical schemes are obliged to, they're not for-profit entities, and they don't make profits that are shared up amongst shareholders. They're non-profit organizations, but they do have to maintain a commercial viability. which means that deficits aren't ideal for a medical scheme, and as a result, the contribution rates for next year are probably likely to be a couple of percentage points above CPI.
All right, I've got to thank you for that, Jeremy. Thank you for your insights here on eNCA. Really interesting information that you have shared around the impact of COVID-19 on medical schemes and what the forecast looks like in as far as whether your contributions will be going up and by how much. So a lot still up in the air, according to Jeremy Yatt there from Fedhealth.